An important topic for discussion is the types of anesthesia that we use for facial rejuvenation procedures. Personally, I'm of the opinion that general anesthesia is an unnecessary risk and cost for most facial rejuvenation surgery, and it actually makes the procedures harder to do because there's an endotracheal tube in the way that's distorting the face. I like to do my facial rejuvenation procedures, including facelift, brow lift, blepharoplasties, facial fat grafting, facial implants, and CO2 laser skin resurfacing, using what is called conscious sedation and local anesthesia. There's two ways to do that. The first way is called oral sedation. Oral sedation is a light level of sedation where I give the patient a strong dose of Valium to get them good and relaxed, and then I do local anesthetic injections to numb things up in the areas in which we're going to work. Once the numbing injections are complete, the rest is pretty easy. Some patients may doze in and out of sleep while we're working, while others may remain awake. The alternative is to do IV conscious sedation. IV sedation is a deeper level of sedation where we put an IV in and we're giving medicine through the IV to doze the patient off to sleep. And while they're sleeping, I do the local anesthetic injections to numb things up. Once I get things numb, we let the patient lighten back up to a lighter level of sedation where they're dozing in and out of sleep in what we call twilight throughout the procedure. So there's awake times and asleep times with IV sedation, but patients typically have little to no memory or recall of the procedure. To do IV sedation, I have to have an anesthesia provider do the sedation so that I can concentrate on the surgery. Oral sedation's okay for smaller procedures like blepharoplasties and laser procedures, but IV sedation is the preferred anesthesia method for larger procedures like facelift procedures or multiple procedures performed at the same time. We have a perfect safety record with all types of anesthesia at Youthful Reflections.